It's been about a year and probably 7 months ago it started. Randomly one day, much like most of these people, most of us, it just came on. It started with what I thought was a UTI, and I had no health insurance at the time. So I went to an urgent care and they just gave me antibiotics and said, "You gotta see your primary care." So I went to my primary care and he did a prostate exam and there was some pain on palpation. So he gave me a stronger dose of Bactrim and said, follow up with the urologist if it doesn't get better. A few weeks down, didn't get better. Main symptoms were like sort of like a feeling or like sensation in the perineal area, definitely urinary frequency, hip pain, like pain of the urethra. And so I went to the urologist. They looked me over and they said, listen, like, we're not sure what, everything's coming back negative. No bacteria found. Ran a few tests, cultures. There wasn't anything notable. So they said, finish your antibiotics and we'll try you on Flomax. I took that for a while, didn't do much. And then I was left at a point where I still was in a lot of pain. There was also urinary frequency. I was peeing quite a lot every day, painful after ejaculation. So I had stopped that completely. And at the time, I was only 25 years old. I was like, what's going on? I'm a very healthy guy. I'm a counselor at a addictions facility. So I was like, is it mental? Is something wrong? I already take antidepressants because I know they try to throw those at you. So they were like, it's not that. Can't really add that in. So give it some time. Sometimes like how you always express, like the pelvic floor is out. And so thankfully I did my own research, found myself on Reddit, reading countless threads, as they say, doom scrolling. And I realized this is more than just prostatitis. I was like, it can't just be an infection. There's got to be something more to it. And I had just had just like most people, a breakup occur, a loss of a parent a year prior. So I was like, a lot's happened. Transitioning out of my master's, I was very busy working very long hours and it was painful to sit. I was compensating a lot. So I was like standing different. I was sitting different. I was walking different. Ice packs, heat, sits baths. I was doing everything. And I realized the more I did stuff, it was almost creating obsessive habits. And it wasn't until I started watching your videos. I was watching them all the time. And just, you Google like chronic pelvic pain, your videos come up. So I started watching them, but I never got your program. And then I was like, you know what? This is something that's going to be sticking around a bit. And I have to learn something to manage it. So I bought your program and I started the stretching. And I would say within 2 weeks, it went from like a 10 every day of pain to maybe like, let's say 6 or 7. And I kept doing it. I'm like, there's something to this. So I did it every day. I did it almost maybe too much, but I did it twice a day. And in doing it also, I noticed it created sort of like a meditation practice. It was taking time out of my day to focus on me. I think you say it in one of your videos, like if somebody's looking at you funny for doing this, say you're taking care of your health.
Yeah.
And so I was taking care of myself and I started actually like calming down and having less like emotional attachment to it. And it was through that I realized this is pretty much a mental component as well. And so that's when I started educating myself on TMS and Sarnos's work in unison with your stuff. I read Headache in the Pelvis. I read A Way Out by Alan Gordon, I think it is, and realized, okay, you're having an emotional response to this pain and you're fighting it. You're fighting it tooth and nail. There's flare ups. There's a reason for these. And it was piecing it together that I realized you kind of have to, like, as tough as it is, let it all go and just live and take care of yourself, stretch. I did the elimination diet. That didn't work. I did find things that make it worse. For me, it was like gluten and inflammatory foods. So I cleaned up my diet, stopped smoking cigarettes. That was like my last thing. I'm also 4 years sober. So like never really was drinking. Not even when I got it, I was, a healthy guy. So I would notice that when I went to appointments, it would flare up. Or like one of my main annoying symptoms was, and I don't see a lot of people talking about this, but I would imagine it's more of a problem, is a tingling sensation in my scrotum and movement. Like they were physically moving. And when you do research on it, cremaster reflex and could be, and anytime I see mental stuff on there, I'm like, it's probably that. So it said it could be heat, cold, anxiety, or something structural like a torsion or epididymitis, something to that effect. So I had gotten ultrasound and nothing was found. So I'm like, okay, probably anxiety based. And so I think it was when I realized I had to get a follow-up ultrasound because it was still happening. And at this point, that had went away. And I was doing your stretching, and you had mentioned to me, try the cold and the hot in the shower and alternate and see if that kind of relaxes it. And it was relaxed. It was not doing it anymore. And I went for the ultrasound, and lo and behold, a day later, it's doing it again. And so anytime that I would focus on it, it's there. Flare-ups happen. So that's my story. It was long. There were some dark times in it, of not knowing if this is going to get better. And I remember saying, I'm helping people during the day and I'm coming home and I'm in agony. Like nothing's helping. What is going on? Will I ever be able to have a partner again? Like I had just gotten into another relationship that's going well. I'm still with that girl. And thankfully she's very understanding of all this and works in healthcare. So that was good. But I remember just being so upset and feeling like the healthcare system was failing me. And in a sense, I think I was almost failing me, not to put it that way, but like I had to just witness it as it comes, but be okay with it.
Yeah. No, I
Yeah.
mean, your story has so many parallels to mine as well. Being young around your age when it started, again, the antibiotics, the Flomax, none of that working. Even the cremaster reflex thing in the testicle had that experience, and the perennial pain and discomfort. But glad that the stretching really gave you something that helped your body feel better. And like you said, it put you in a space where you're loving yourself. You're taking time out just for you to calm down, to relax. Because it's not just the musculoskeletal side. Like if someone is
Yes.
stretching and they're going crazy in their mind, thinking about things, planning things, like worrying about things, etc., you're just counteracting it anyway. So deep, slow
Yes.
breaths, settle in, and there's that. I was curious what other practices in the program were helpful for you. What were some other things that you noticed were kind of needle movers as you got better?
Yeah, yeah. So I think obviously the videos are so helpful. The stretch routine itself is really like stuff I use to this day. I tend to use the first video a lot still as like maintenance kind of. I just think that it's perfect for like, and it's laying down a lot. So if you're tired, like you're already worked out and stuff, you could do that one. It doesn't take too much, but it also still is keeping that fluid and stretched. But I really like the journaling. I'm a big advocate on journaling too, and like CBT, like telling people to write out their thoughts and their emotions and try and slip it to positive. So I think I really did like going through your past and like how you're hard on yourself and your childhood and writing down things and almost a thank you letter to yourself helped a lot. And it kind of got me more into thinking like how can I help others with this? So that's one of the things I've been doing now in my practice is that I, so I'm still in school. So technically I'm like an intern, but I do have a caseload and I see a lot of clients with chronic conditions and I teach them about mind body work a lot. And I have helped people. I had a client with what was presenting as pelvic floor dysfunction, doing stretching and the urinary frequency went down. And I have clients with like chronic conditions that just being able to like not be so attached to the pain and not be so like bound by it and just living has helped them so much. I did start working out again and I had to kind of revamp and say, okay, because I was afraid to work out. I was like, is it going to cause a flare up? Can I only do upper body? And I had to kind of just go and say, like, ease into it. Go on the elliptical instead of the treadmill. Don't be running fast and maybe don't squat for a week or two, but just see where you're at. And it was just like giving myself permission of you're okay, you're healthy. All things aside, you are healthy. And seeing it's like 6 month periods. If I look back on 6 months, you see that it gets better. It definitely wasn't overnight, but taking inventory on myself, I see that even like in the next 6 months, I'm sure it'll drop down like to today. Yeah, I still have some pain, some flare ups, some discomfort at times, but it's so much less frequent and it's so much less intense when it does occur. And
Yeah.
even that's been going like I urinate normal amount. Like I just came out of a shift all day. I didn't go to the bathroom once and I'm hydrating. So the change, I was urinating, 15 to 20 times a day. I mean, the tip pain went away. That cremaster reflex is gone. So the last thing to stick around is the perineal pain. But even then, it's usually due to a reason. Like I worked out really hard or I was sexually active, something to that effect.
Yeah. Yeah,
Yeah.
these things are just going to continue to fall over time. I think it's important to point out, we call these success stories, and it is a success story. You've had a
Oh, yeah.
tremendous overcoming. You came from a seriously dark place, not understanding, not being held, not being guided by the medical system, to realizing, okay, my brain and nervous system can and is creating these symptoms. It's safe for me to live life. And this is why people are like, am I going to be fully healed? Is it like, does it take a month? Does it take a week? Like, what does that look like? If you have a needle in your arm or something, or some sort of thorn, and there's an infection and you remove it, like there's something very matter based, very physical there, and the body can heal. If you have a pathogen, like an actual bacteria that's making you sick, and you flush it out and you have an antibiotic, you can heal, like, right? There's a specific thing that we're counteracting. But with neuroplastic symptoms, the brain and nervous system are creating them because of underlying stress factors.
Yeah.
The good news about this, right, is that there's nothing wrong with your body. Your body's
Hmm.
safe. The other side of it is that you may have symptoms still at times coming in and out. And it's not that you're always going to be in this purgatory of like never feeling good, because
Yes.
there's definitely a bigger shift or letting go if you're still like there. But yeah, exactly. Just continue and love yourself, follow the path, listen. And that kind of leads me to what I wanted to ask you about. When this started, you were going through a lot of grief and stress, I imagine, with the relationship situation, and then also a loss of, did you say it was your
Well,
grandparents?
yeah. My father.
It was your
Yeah.
father? Wow, okay. That's really hard. So a lot there. And yeah, this
Yeah.
is really, I've seen this a lot of times because there's so much emotion, and often we just keep moving on with our lives and we
Yeah.
haven't really learned how to integrate that. And so the body can flare up something. And then, as you know, like when you have symptoms, we can get really scared, especially if we don't know the answer to why it's happening. And so we learn the pain become, the neural circuits become learned. But
Yes.
I'm curious about that side of things, maybe the relationship or your father. Did you have moments where you were able to open up to some of that, maybe let some of that pass through? 'Cause
Totally.
I think, yeah, tell me about that.
Yeah. So I think one of the biggest things that was for years. So like I had adverse childhood experiences, and you name it. And I had a substance use issue and that I am recovered or in recovery from. And I was constantly, so like, yeah, I was going seeing a therapist. I was on medication treatment and I was doing all these things, did the CBT, did all of these inner works, but I was still living angry, young, fast, agitated all the time. And it it took like I always joke that if nothing else with this pelvic pain, it literally it forced me to sit down. It forced me to calm down, and it made me I was stuck in bed for months, I had a lot of time to think. And in that I took it and saw that it did really transform me into a person who's able to let things go, able to process more. And I was going through my master's of social work at the time. So I was learning all these things to help other people and implementing them myself in my life. And I think it was like the perfect combination because it was stressful and a lot did happen. And I do see that it definitely happened during that time. And I like how you said, when are you going to be like fully healed from this? Because it's a lot like when I help people with recovery. They're like, well, how long till I don't get cravings anymore? How long till when is this going to work? And it's like, you have to just take it one day at a time. There is no, we want not perfection. We don't go for perfection. We're trying our best. And it's almost like the letting that 100% healed mentality go is what creates the 100% healing. The
I just
more
got
that you
chilled. That's it. That's so big. That's so big.
Right? I just the more you're focused on it has to be like even today, like I was standing all day in front of people talking. Like, yeah, I could use a stretch, but is it the end of the world? No. Is it going to ruin my night? No. Like, it's okay. It's okay. People have much worse things going on. And I do like that it isn't it in a way, yes, it's tough to go through because there is no quick fix. There is no, oh yeah, this, and this care path, and you're good. But you, in a sense, don't have anything structurally wrong. So you can live still. You just have to implement new tactics, new strategies.
Yeah.
Yeah.
I'm wondering what you would tell someone who is on the fence about thinking, well, mine's probably structural. Like the pain is so bad, the symptoms, like there has to be something wrong. There has to
Yeah.
be something going on in the muscles, or there has to be like something that my doctors haven't found. And they can't really trust what we could call the mind body healing path. Like,
Hmm.
what do you say to them?
Yeah, that's a good question. I know that one's so hard to, especially I feel like a lot of us men get this. And women too, with like vulvodynians, but that's like we are kind of that like really strict, hardworking, fast type A personalities. And it can be hard to trust the process. I think for me, the biggest thing was to just like sit with it, take the time and just give it a shot. What do you have to lose? Like, even if you still, let's say for a couple of months, want to keep thinking it's got to be structural, it's got to be structural, and going to these appointments, like in time, while you're doing that, still do a stretch routine. Maybe see the physical therapist, do, the internal work if that doesn't create more discomfort. Because the best thing for me was, and unfortunately, I'm very stubborn. So I had to like strike out a bunch of times. I
Yeah.
probably went to, let's say, 60 doctors before I was driving to Manhattan once and like almost getting in car accidents trying to
Like
find the best
literally
doctor.
60 doctors, maybe that many.
I would say so. I mean, the amount of times I
Wow.
went back and then went back, I went to my PCP, let's say 10 times. I went to this one urologist that I went maybe 5 to 6 times, then didn't like his approach, went to a different one who knew nothing about it. I saw the pelvic floor physical therapist a bunch of times. I went to pain reprocessing therapy. I invested a lot of time in this. And the funniest part is the best thing for me was I was driving to Manhattan and I said, this is a lot, man. Like, you got a lot going on. Like, we got to take a little break on this. And I had told myself, I'm like, just do like a couple months, nothing, but the stretching. Just take a couple of months, eat healthy, try and focus on your mental health, see where you're at. And I realized it. I like my last thing was the donut cushion. I was so afraid to sit anywhere without the donut cushion. And I had to like taper down. So like my sister has a car that has a heated seat. So I was like, all right, when you're in her car, don't have the donut cushion, but put the heated seat on because you're getting that heat therapy, like almost tricking myself into trusting myself.
Yeah.
And then lo and behold, you didn't need the cushion, you didn't need the heat, but it made me comfortable. It made me not have that response. Like in the beginning, it hurt so bad I would be fighting it and moving my legs like crazy. And the more you're doing that, the more I'm getting flare ups. So I
Yeah.
hope that answered your question.
Well, yeah. No, it sounds like sometimes you just have to hit a wall over and over and over
Yes.
again. someone's ego has to be broken open, their mind has to see a different way. And but also even like the things that you use, such as a donut cushion, and it's okay to stair step it down and realize, okay, I'm safe even without this. And that's important. I mean, I also used the donut cushion for like 2 or 3 years, and thankfully that thing's rotting away in a landfill somewhere. That thing, that thing is so annoying. Like I brought it with me on airplanes. I brought it with me in cars. It was in
Mhm.
public. People were like, "What is this guy doing?" I'm like, "I'm not using the bathroom. Like it's just a cushion." But it's it's fun. I'm glad though that you trusted, you opened up, and yeah, I'm happy to hear that you're doing so much better and that I've been able to help in some way. The program was helpful for you.
Absolutely, and the sitz bath thing was the last thing for me like that to, like, throw out, and I was so happy to get rid of it. Like, I'm so tired of this, and I will say I did find a very good urologist, thankfully. At the last one was a very good urologist. He's based out of the Bronx, and he is so well-versed in this that he knows it's mind body. He knows that it's pelvic floor dysfunction. He doesn't even, like, really, like, give any time to it's bacterial. Like, he saw on my records, he's like, no, 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 we're not throwing you on meds. He's like, this is what you're gonna have to do. And he made a list of things, and there were things I had been being told a bunch of times. But he also said, but I'm here to support you. Like, if you need anything, you contact us. But for the next like 3 to 4 months, like, just do this. And it was really just don't strain when you pee, try to limit sitting as much, stretch, pelvic floor, physical therapy, eat better, all holistic approaches. And it made me realize, okay, I think it was like a doctor's finally telling me this, Um,
Yeah.
it's not just YouTube, Reddit, and myself. So
Yeah.
it was really enlightening, but it was that stubborn, like having to keep hitting the wall, like you said.
That's amazing. I'm so happy to hear that there are a few urologists out there like that, and doing my best to go to conferences or bring them books, and so that we can just bring more information forth so that guys don't have to go through years of this before they finally realize what is really happening.
Yeah. And I even gave my one urologist the book, The Headache in a Pelvis, and he took it on. And then during this whole process of all these tests, they found a disc herniation, which had no correlation to any of this, but which also got better from your stretches. My posture has gotten better. I could
Awesome.
stand longer. The back pain's gone. But
Awesome.
the guy was like, "You are so well versed in this mind body stuff." And I said, It came from a lot of dark times of not really knowing what else to do." And I recommended that book to him, and he actually took the recommendation. So, yeah, I feel that trying to empower others in this journey.
Yeah, it sounds like, you've learned so much. You're changing the way you're being, and you're going to help so many people, in the line of work you do too. It's so directly applicable. So thank
Yeah,
you, Darian, for sharing it and
of
helping others.
course. No problem. I'm happy to.
Well, thanks for this. This was an amazing experience to hear your story and to see you doing better and being more vibrant and happy and moving and living life again. So thanks for telling everyone about it.
Thank you so much. And it was so good to actually meet you, not just hear your voice on the videos.
Yeah, no, we'll connect again. All right. Take care.
Oh,
Thank you so much.
absolutely. Thank you.
Bye.